Hi, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the 5 key points on epidural steroid injections. Epidural steroid injections have been around since the 1960s. So it's been over 50 years that they've been in use in both orthopedics and pain management. And there's a reason for that, because they work very well. So the first takeaway point is that epidural steroid injections have been around for a very long time. It's not like they were, first started being done 3 years ago, and we still don't know, the track record. We have a long track record in place for these injections. The second takeaway point is the premise behind why epidural steroid injections are done. Epidural injection is not going to fix the problem that you have. Now, whether that's a pinched nerve from a disc herniation, whether that's a spinal stenosis situation where you have arthritis, overgrowing bone and soft tissue and pinching on nerves, it doesn't fix that, but it can give a nice soothing anti-inflammatory reaction around the area of the nerve root to achieve pain relief. And that may last for weeks, months, and then it can be repeated. But the premise here is that, let's say you have a disc herniation pushing on a nerve root. The anti-inflammatory can relieve the inflammation in the nerve root, relieve the sciatica pain, while the body disintegrates that piece of disc. Okay? So that's key takeaway point number 2. The third point is that these are very low risk procedures. There have been some recent studies trying to refute that, but the bottom line is that it's under 1% that the risk of a complication. Okay? It's a very low risk of infection, very low risk of some bleeding. It's higher if you're on anti-clotting medications. Those should be stopped, 5 to 7 days prior to the procedure. There's a low risk of an allergic reaction, very low risk of a nerve injury, but the risk profile is under 1%. So when you look at that risk and the benefit, there's a huge reward with opposed to the small amount of risk. So the problem that we had last year with the fungus, that was a problem from one of the compounding pharmacies where a lot of people got a fungus infection. That was so aberrant and off the norm that it's just not what we normally see. Normally, the pain doctors at Arizona Pain Specialists have done thousands and thousands of epidural steroid injections, and the risk of complications is under 1%. Okay? So the fourth takeaway point is that a series of epidural steroid injections is often necessary to achieve the best pain relief. So it may be that you have sciatica and you get an epidural steroid injections one time, and then it works pretty well, so you end up getting a second a couple weeks later, and it may be necessary to get a third after about 4 to 6 weeks. And that's a typical series, and that provides usually the optimal relief for your problem. And it can be repeated every few months. Oftentimes it doesn't need to be repeated. Oftentimes the disc herniation will disintegrate. That was enough to give pain relief, and then that's it, okay? But it may be necessary for, say, spinal stenosis, a problem that's going to be there off and on for years, and it may be necessary to do a series of injections, okay? So the fifth takeaway point is the effectiveness of these injections. So there have been dozens upon dozens of studies looking at epidural steroid injections over the last 20, 30 years. Now, the first issue with these is you have to look at whether fluoroscopy was used, which is the real-time x-ray. That's necessary because it has shown that over 30% of those without using that are placed in the wrong area. Okay, so any good study should have pain doctors using fluoroscopy. All the Arizona pain doctors do. And when you have studies like that, the usual outcome is 75 to 90% good to excellent. Okay? So that's important, but that's a very good outcome. And you have such a low risk, you have high reward, you want to avoid surgery, and you're often able to with epidural steroid injections. So there you have it. Those are the 5 key points with epidural steroids. The Arizona Pain Specialist has 4 locations around the valley. They accept over 50, you got that, 50 insurances, including workers' comp, personal injury. They also take self-pay, Medicare, Medicaid. And the pain doctors are board certified, fellowship trained. They also have chiropractors on staff. They offer spinal decompression therapy, acupuncture. So there's a whole umbrella of services at the clinics. Check us out on the web at preferredpaincenter.com. Ton of information on education on conditions, treatments, as well as epidural steroids and pretty much any other pain condition that you can think of. Or you can call us at 602-507-6550. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.